My name is Sarth Kaluru. I was one of the newest partners at Central Carolina Kidney Associates down the road. I just started about 6 months ago. We've been here in practice for about 5 years now, serving the greater Burlington area. And I'm just going to talk to you a little bit about kidney disease and who's at risk and what we can do to prevent kidney disease and help slow it down, and just give you an overview of everything. Feel free to ask questions throughout, and feel free to ask questions throughout. And this is going to be pretty informal, so whatever comes to mind, go ahead and say. Oh, okay. Can everybody hear me? Okay, there we go. A little bit about myself. I just finished my fellowship at East Carolina University. I did my training there. I did my medical school in St. Eustatius in Queens, New York. I'm sure many of you are not familiar with the school. And I did my undergrad at UNC Chapel Hill, born and raised in North Carolina. So I'm glad to be back in North Carolina. So, all right. So a little... All right. So first thing I want to talk about is, where are your kidneys? Now, people, your kidneys are located behind your rib cage, in your back. Despite popular belief, you really can't feel your kidneys. They don't have pain nerves, so you only start feeling stuff when it goes below the kidneys. And you see, the kidneys are pretty important. You got two of them. Many people are actually born with only one kidney, and yes, you can survive with one kidney. The kidneys get blood brought to them from the heart. Actually, about 1/5 of the blood that's pumped from the heart goes directly to the kidney. So throughout the day, as your heart's beating, if it's beating 60 times a minute, you can imagine 1/5 of that's going to the heart. So your blood is cleaned throughout the day by your kidneys. So what do your kidneys do? The definition from my medical textbook is that they remove waste products and excess fluid from the body. Now, these excess fluid and all this waste products are made into urine, and that's what you urinate. So here's a little cartoon description of how the kidneys work. It's a little bit more complicated than this, but basically blood comes in, the blood goes to the kidneys, they get filtered, the waste products and that fluid gets made into urine, the clean blood then exits the kidney, and you have urine that goes down to your bladder. So it's pretty highly complicated, as I said. Like, the kidneys do a lot. They filter your blood, and then they take things back into your blood and put things back into the urine. So it's a pretty, and there's lots of sensors and different hormones involved to make sure your electrolytes, the chemicals, and all your body products stay balanced within your body. So your kidneys actually do a very big job in keeping your body in a stable metabolism and keeping this chemistry correct. So the way we explain it to everyone, the people that come to see me in my office, I tell them, look, your kidneys control your electrolytes. They make sure your potassium is at a normal range, the salt level in your blood is in a normal range, and the acid level is actually in a normal range. So in addition, your kidneys play a big part in your blood pressure, controlling your blood pressure. So when your kidneys can actually sense if there's too much, the blood pressure is too high, it can actually release hormones that make your blood pressure come down a little bit. In the same regard, the kidneys can sense if your blood pressure is too low, and can actually send out hormones that actually make your blood vessels constrict and make your blood pressure go up. So the kidneys are very smart organs that work on your blood pressure, and that's why we're called nephrology and hypertension, because we actually deal a lot with hypertension as well. So in summary, the kidneys remove waste products from your bodies, also helps clear a lot of the drugs and chemicals from the body that you ingest, helps balance the fluids in your body, helps regulate your blood pressure, And also importantly, people don't realize is your electrolytes include vitamin D, calcium, and phosphorus, which are very important for bone health. So when your kidneys start to get damaged, you can also start to have bone problems. So it's very important to keep your kidneys healthy for that reason too. The last thing that I wanted to mention about the kidneys is actually the kidneys have sensors that sense how much red blood cells are in your blood. And if they don't sense enough blood cells in the blood, it actually produces a hormone that goes to your bones to help produce more blood cells. So if your kidneys are not working, if these sensors are not working, or is unable to produce this hormone, you're not unable to, you can become anemic. And so that's another side effect of kidney disease. What is kidney disease itself? Kidney disease is defined as some type of kidney abnormality. Things we describe as kidney disease is when you have protein in the urine, because remember, your protein should stay in your body. Your body wants to keep the protein in its body, but the kidney filters, if they're not working correctly, they can actually have the protein leak through the filters and not be reabsorbed. And what will happen is we call that proteinuria, protein in the urine. Also, if you have waste products in the blood that are not being cleared by the kidneys, the waste products levels go up, and we can see that. And so we say if these things happen for longer than a 3-month period, we say that this person must have kidney disease, and we have to find out what the cause is to eliminate that cause, and also to help alleviate it and try to cure the kidney disease itself. So remember, some kidney disease are more likely to run in families. I'm sure you've met those people their brother's on dialysis, they're on dialysis, their mother was on dialysis. So we always have to remember that. We need to make sure that people are cognizant of who in their family has kidney disease and if they've been checked for kidney disease themselves. So, kidney disease is a condition when your kidneys are damaged. Your kidneys are not filtering the blood as well as possible. And the damage to the kidneys will lead to buildup of waste products in the body. Now, this waste product, we call kidney disease a silent killer because you don't really have symptoms of it. But these waste products building up in the body, they can really do some affect your different organ systems and all that. People with kidney disease have a higher risk of cardiovascular disease, that's heart attacks, strokes, anemia, as I mentioned, bone disease, as I mentioned, other things. People with kidney disease have a higher risk of developing dementia, and the dementia is because these waste products are in their blood, and they're actually building up in their brain, and their brains can't function as well. People with kidney disease have increased risk of falls, increased risk of hip fractures. So it's a pretty important reason to find out if you do have kidney disease. You don't want to end up with any of these medical problems. So there's been pretty good number of studies to show people with kidney disease, they have increased risk of death, cardiovascular disease, as I said, poor quality of life, and actually people with kidney disease, we're not sure the link, but have an increased risk of depression. So it's another main reason to get screened for it. So who gets kidney disease? Now, kidney disease is more common than you think. 26 million Americans in 2007 were diagnosed with kidney disease. That's close to 8% of the population. By 2020, the CDC is thinking around 10% of the American population will have some form of kidney disease. That's a lot of people. That's 1 in 10 people. So this is definitely a growing epidemic and something people need to be aware of. Some people are more prone to get kidney disease than others. Diabetics. Currently, 35% of people who have diabetes has some form of kidney disease. That's a large number of people. And then 20% of people with high blood pressure have kidney disease. And there's many other diseases out there that increase your risk of getting kidney disease. Now, one of the things that's very important, and what we're finding out more and more throughout the years, is people above the age of 65. It seems like these people seem to have an increased risk of getting kidney disease compared to the rest of the population. We're not exactly sure why. but we would like to find out. So a lot of research is going into that. That being said, anybody can get kidney disease. You don't have to. We have very young patients that with kidney disease, and we have much older patients. We have males and females, and we have all races and ethnic groups that get kidney disease. Some of the risk factors that we talk about, including diabetes and hypertension, which I mentioned in the previous slide. Cardiovascular disease, if you've had a heart attack, if you have congestive heart failure, if you have a history of a stroke, have high cholesterol, you're obese, as I said, mentioned family history, and all of these things have increased your risk of getting kidney disease. Now, also importantly, is many people who get admitted to the hospital, they get repeated episodes of kidney failure. Now, these people actually will have an increased risk of having long-term kidney disease. And so that's another thing. When I'm looking through your chart, well, not your chart, but looking through people's charts, I'm cognizant if they've been in the hospital before and if they've actually had an episode of kidney failure in the past. A lot of times that will lead to a chronic kidney disease state. So, diabetes, leading cause of kidney disease in this country. A little bit about diabetes, just to explain it to everyone in simple terms, is a disease where your body does not make enough insulin, or which we used to call type 1 diabetes, or cannot use the normal amounts of insulin properly, which we used to call type 2 diabetes. Now, the result is a high blood sugar level that leads to problems in many parts of your body. Diabetes is a leading cause of blindness in this country. One of the things it does is the sugars actually are so high they damage the nerves and blood vessels, not only in your eyes but also the rest of your body, including your kidneys. And what this does is it actually forms these plaques in your kidneys. And once these plaques are in your kidneys, you can't get rid of them. There's no medicines out there yet that we can do to prevent these plaques. So once someone has diabetic kidney disease, we unfortunately had to tell them that the kidney disease is there to stay. Now, we can slow the progression of these things. One of the main things to do to slow the progression of diabetic kidney disease is control your blood sugar. When blood sugars are controlled, slow the progression of it if you already have kidney disease. If you're a diabetic, controlling your blood sugar is the number one way to reduce your chances of getting kidney disease. High blood pressure, also known as hypertension, second leading cause of kidney disease in the United States. Also the number one cause of kidney disease throughout the world. Now you can be confused because high blood pressure can cause kidney disease and kidney disease can cause high blood pressure. So that's one of those things when you ever see your doctor is to figure out which one came first. So blood pressure it's a little difficult to explain, but it's basically when the blood is forced against your blood vessels at such a hard rate that it increases the tension in your blood vessels. People with high blood pressure, of course, have increased risk of strokes, increased risk of heart attacks, increased risk of heart failure. So one of the things we always tell our patients and people in general is to control your blood pressure, bring it down to a normal range. People with high blood pressure, if you can bring their blood pressure down to a normal range, their risk of kidney disease is almost the same as people as the normal population. So that's what we emphasize people when they do have been diagnosed with high blood pressure, is to take their medications properly and to check their blood pressure on a regular basis just to make sure it's controlled. Glomerulonephritis is something you might hear about a little bit. It's inflammation of the kidney's filters, which we call glomeruli. Glomerular is filters in Greek, and nephro is kidneys in Greek, so the kidney filters, and itis means inflammation. There's many types of these. These can happen very slowly or can happen very suddenly. It can happen in all range of people. I think this weekend, I met a gentleman who's 87 years old who we just diagnosed with glomerulonephritis. So you're never too old to get this disease. And here's a little picture. Don't worry, there's no quiz at the end, but this is basically showing the microscopic picture of the kidneys, and it shows the filter with inflammation. The third leading cause of kidney disease in the United States, and a very, very fast-growing cause of kidney disease throughout the world is nonsteroidal anti-inflammatory drugs. These medications, actually, we use them all the time for pain, for fevers, for arthritis, and they're very good for arthritis. But they've actually, studies show that these actually help promote certain hormones in the body, which increase the constriction of blood vessels, and this can actually lead to heart attacks and can lead to kidney disease. The good thing about these medications is if you stop these medications altogether and you have kidney disease, the kidney disease will not progress. And sometimes it will actually improve. Some of the nonsteroidal anti-inflammatory drugs we know of is ibuprofen or Advil, celecoxib or Celebrex, meloxicam, naproxen, which is also naproxen, or Aleve, diclofenac, which is also Mobic. And also, ibuprofen is found in BC powders and Goody powders. All these medications are great for arthritis and great for inflammation, but if you use them at a high dose for daily for several years, you can definitely lead to kidney damage and also other problems such as anemia, asthma, and stomach ulcers. So my recommendation is I don't tell people to stop this altogether. That's almost impossible. What I tell people to do is reduce the dose. If you're going to take ibuprofen, only take it 2 to 3 times a week, and only take the 200 milligram tablets. Don't take I know there's people out there who will take 800 milligrams of ibuprofen because it works so well. And the same thing with some of these other medications. Take a little bit of dose and only take them 2 to 3 times a week. And if you do end up with kidney disease, I would recommend starting to take Tylenol for your arthritis or whatever. Other options to prevent you from using these medications are heating pads, ice packs, capsaicin cream. All of these things can also help with pain just as well as these medications. And for fevers, I actually recommend using over-the-counter Tylenol over these medications if you are sick and want to treat your fever. Polycystic kidney disease is another disease that people need to know a little bit about. It runs in families. It's the most common inherited form of kidney disease, especially in this country. The kidneys actually form large cysts that get bigger over time. It can cause pain in your abdomen. It can cause high blood pressure. And it can lead to serious kidney damage and kidney failure. If anybody in your family or a close relative has been diagnosed with this, I would recommend getting an ultrasound of your kidneys. Right now, the standard of care at our practice is we ultrasound almost everybody who comes to the door because we feel that we don't want to miss this disease right here. And also to look at your kidneys to make sure there's nothing else going on. There's other inherited diseases that you may or may not have heard of. Definitely if you have a family member with these. Alport's, which is kidney failure plus hearing loss, usually in the younger populations, in the 20, 30-year-olds. More likely men than females, but primary oxaluria, again, mostly men versus females. These people have kidney stones and liver failure at a very young age in their 20s and 30s, and cystinuria, which is actually more in females. And these are all genetic disorders, and if anybody in your family does have this, it would be a good idea to be screened for these things. So, how do you know if you have kidney disease? Kidney disease is one of those things we call this one of those silent killers because you don't really have symptoms per se. You're going to still make urine just like anybody else because we'll say your kidneys have filters and their filters are going to stay open. It's just they're not going to be smart about how they make the urine. So some of the things we look at is high blood pressure. As I said before, high blood pressure can cause kidney disease, but kidney disease can also cause high blood pressure. So anybody who has has high blood pressure should be screened. What we do usually, most primary doctors should test what's called a urine analysis, and this is a simple test. It's done in most doctors' offices. You don't need special equipment or anything to do it. It's basically you test the urine for blood, and you can test it for protein. another simple blood test that should be done routinely in all patients, and is of checking for blood levels of creatinine and blood urea nitrogen, or the BUN, in the blood. Now, these are waste products that are easily filtered by your kidneys, and if they're building up in your body, that means that your kidneys are not filtering them adequately enough. More complicated reasons are ways to look for kidney disease is a calculation where we calculate the blood and urine measurements, and this is usually done. We send this out to LabCorp when the labs is done in the hospital, and we check for the glomerular filtration rates. Actually, one of the things I need to talk about is sometimes people think, oh, well, I'm making a lot of urine, so it must not be any problems with my kidneys. But actually, your kidneys are very smart. They don't just make urine for the sake of making urine. But if you're making a lot of urine, waking up in the middle of the night, having to use the restroom and all that, that could be a cause of kidney disease as well. Of course, decreased urine output, and then, of course, swelling. Swelling, if you're swelling, that means your kidneys might not be able to regulate the amount of fluid in your body, so the fluid's going somewhere else instead of out of your body, end up in your legs, or unfortunately sometimes it can end up in your lungs, which can be dangerous. So how do we detect kidney disease? So why do we do it? Well, the reason we do it is because if we can detect it early enough, we can stop the progression and treat a nip in the bug, per se. So we detect it by checking your blood pressure, checking for protein in the urine. Remember, having a little bit of protein in the urine, especially after exercise or a stressful time or eating a lot of protein, such as eating a lot of meat, it can be normal. But having excessive amounts of protein could mean the filters in the kidneys are damaged. And the blood creatinine is a simple blood test any doctor can do, where they just test the blood and check for creatinine, which is a waste product of your muscles. So if this is elevated, the kidneys might not be filtering correctly. And remember, there's always exceptions to every rule, because creatinine can actually go up because of certain medications you're on, or you can have low creatinine because you don't have enough muscle mass, so kidney disease could be masked in that way. Some other people who should be tested, anyone who's diabetic should be tested for kidney disease. Anyone who has high blood pressure should be tested for kidney disease. Anyone above the age of 65 should definitely be tested for kidney disease, since I showed you the slide where a disproportionate number of people above the age of 65 end up with kidney disease. Overweight patients, people who are overweight definitely need to be tested for a number of things. And of course, anyone with family members with kidney disease. One of the things I need to stress is people who are overweight. Your body is bigger than it should be. The organs in your body, it takes a lot more stress out of them to regulate a body that it's not used to, because it's so large. So one of the things I recommend for all people is to moderate the amount of food they eat and try to get on a daily exercise regimen, which I think I have slides about later on. So who should be tested? We talk about different ethnic groups and racial groups in this country. It seems like everybody, Native Americans, African Americans, Hispanics, South Asian Americans, everybody seems to need to have some screening. There's some high risk, and we're not sure exactly what it is, if it's genetics, if it's diet, if it's environmental, but it seems like many groups do have an increased risk of kidney disease. But me being a kidney doctor, I recommend anybody who feels that they need to be screened for kidney disease, go ahead and get it done. All right. So I'm going to just quickly go over some of the ways we treat kidney disease, just so people aren't scared. One of the things is dialysis sounds very scary, and I would like to just let you know there's currently in the United States there's over 150,000 people on dialysis right now. And there's about 1 million people with kidney transplants in this country now. So it's becoming much more common, and people are doing many things with their lives when they have kidney failure. Good news is many kidney diseases can be treated successfully Another good news is a lot of them can be, even if they can't be treated completely, we can slow the progression down to a very good degree. And unfortunately, there are those diseases out there. We don't know the causes, and we don't know how to cure them. So it's a wide range. So what can we do to slow down the progression of your kidney disease? The one thing I have to tell everybody in this room, and I tell people at dinner parties, I tell them the one thing they can do for their health in general is to stop smoking. Smoking is putting a lot of chemicals into your lungs and into your body. And stopping smoking, one is it helps a paycheck, and it helps you out. And smoking increases your risk of cancers, cancer in your lung, cancer in your throat, cancers in your bladder. Smoking causes heart attacks, it causes strokes, it causes peripheral vascular disease. So there's a lot of reasons to stop smoking. Another part about smoking is you may not be smoking, but you have a loved one who lives at home who smokes. So secondhand smoke is a dangerous thing as well. If you don't smoke, get the person who lives with you to stop smoking or have them smoke outside. What we mentioned before, controlling blood pressure. Certain medications for blood pressure have been used to slow down progression of kidney disease. Some of those are called ACE inhibitors or ARBs. Some of those are lisinopril and enalapril, ramipril, losartan. There's tons of them out there now, and a lot of them are $4 on medication lists without any insurance. So they're readily available. They're cheap. They've been around for some of them have been around for 30 some years. So they're very cheap and available as generics. And so far they're pretty safe. I wouldn't take the medication, of course, unless I had a physician following me, because sometimes it could be a couple side effects. As I said before, control your blood sugars. This is not just for the diabetics, but anyone who's overweight, has a metabolic syndrome, or pre-diabetes. Controlling your blood sugars are pretty important. As we mentioned before, avoiding the non-steroidal anti-inflammatory drugs, the ibuprofens, the BC powders, the Goody powders, the Aleve, the Advils. Try to use them as minimally as possible. I know that there's many medical conditions such as migraines and arthritis where you do need them, so I'm not telling you to stop them altogether. I'm just telling you to reduce the dose and reduce the frequency. Controlling your weight, important. I can't emphasize this enough. I recommend everybody I meet to try to get into an exercise regimen. You don't have to lose weight. I just want you to exercise, and controlling what you eat. And reducing the salt intake. One of the biggest problems in this country is the American diet. You eat around 8 grams of salt. Now, the World Health Organization says we should only eat about 2 grams of salt. So that's 1/4 of the amount of salt. What can we do to reduce our salt intake? It's not easy, because salt is everywhere. It's a preservative. So we use it in a lot of the processed foods, and a lot of the foods we buy in the store are preserved with salt. And then when you go to restaurants, the reason that food tastes so good is they add salt to it. You go to Chick-fil-A, that food is full of salt, but it tastes great, doesn't it? So what I'd like to say is prepare more meals at home. That way you can control the amount of salt in it. You also control all the other chemicals that end up in your meals. Obviously, if you have a table shaker of salt, just put it to the side. Try not to use it. There's Mrs. Dash. There's plenty of other things out there that you can use to season food. All right, so I'm going to talk a little bit about kidney dialysis, and because it's pretty scary actually when people hear about these things. Just to tell you that there is life after your kidneys do fail, and so there's 3 types of kidney replacement right now. The first one is hemodialysis or blood dialysis. Most of the time, this is done at an outpatient clinic. You come 3 times a week. It's the most common way to do dialysis here in this country, but it also can be done at home. Here's a kidney machine we do use at home. So, person will be sitting on their sofa and have a family member or a friend come hook them up. They'll watch TV, hang out with friends for an hour or so. You do this every night. And actually, home dialysis has been shown to control your blood pressure better. And people have actually had studies showing that it's keeping your bones a little bit healthier than the regular dialysis. So this is definitely an option, definitely for people who would like to spend more time with their families and loved ones. The belly dialysis or peritoneal dialysis, generally it's done at home. There's two types. One where you hook yourself up to a machine, and you go to sleep and wake up and unhook yourself, and the other type where you actually do the exchanges at night. This is actually very popular outside this country. It's the number one way to do dialysis in several countries, including Canada, Hong Kong, France, I believe also Italy. This is actually popular, and it's a good option for people who are still working, people who are in school, or people who just have very busy lives and they can't afford to spend 4 hours at a dialysis center 3 times a week. And it's kind of confusing sometimes, so I like to show a picture of how this works. So you basically have the dialysis bag up here. It's hooked up to a catheter that goes into your belly, and the dialysis fluid comes back out and drained here. And people can sit on their sofa, they can lay on their bed while this is being done, and go about and do whatever they like to be doing. Other thing is kidney transplantation. Statistically, this has the highest rate of success. I mentioned before the two types of dialysis, peritoneal dialysis and hemodialysis. Both of them actually have equal number of complications, and so there's not that like one is better than the other. They're both about the same. Statistically, transplantation is the highest success rate. Unfortunately, it's hard to get a kidney. In the state of North Carolina, I think the waiting time is around 5 years. But kidney it can come from a person who's deceased, or you can get a kidney from a healthy person who might be a relative, a friend, or even a stranger. There's many ways of getting a healthy kidney. All right, so I've left on here some links to some very good organizations that have very good websites on how kidneys work, what they are. There's a lot of information on the internet. Some of it's good, some of it's not so good. So I think guiding people in the right direction. But these are 3 pretty good websites that have pretty good stuff on them. All right. Thank you very much. And remember to love your kidneys.